All right, so anti-epileptics. Anti-epileptics are dealing with seizures, right? Seizures are just going to be any abnormal electrical discharge from the brain neurons, and they typically happen at really high frequencies, and so the brain is just kind of like freaking out, right? Epilepsy is going to be anytime you have recurrent seizures. Epilepsy is a little bit different than convulsions. Some epileptic events include convulsions, but anticonvulsants and anti-epileptics aren't always the same thing, okay? So anticonvulsions will stop the muscular twitching, but it doesn't have to be an anti-epileptic for that. Two major types of seizures are generalized and partial. Generalized is going to involve both hemispheres of the brain. Partial can be very specific locations. Your partial seizures can become generalized over time. So the types of epilepsy, it's really important to know which type of epilepsy is going on because there are certain drugs that go better with one type versus the other type. Basically, if anybody's having seizures, they go ahead and they look at the brain waves. Of your generalized type of seizures, you have your tonic-clonic or your grand mal types of seizures. This is probably typically what you think of when you think of a seizure. It's like a whole full body jerk convulsing type of seizure. It's not abnormal for the person who's having a grand mal to urinate, defecate, or bite their tongue. It's pretty common. Your atonic seizures, so atonic means not moving, right? And so with your atonic seizures, what you see is the person just collapses. Like all the muscle tone goes away and they collapse to the ground. Protective measures are usually taken with people who have atonic seizures, and they wear helmets so they don't crack their skulls when they fall. And then you can have absent seizures or petit mal seizures. For these, they have brief impairments where they just might just stare off into space or blink really rapidly. They might have some other stuff going on, but then they carry on like nothing happens. Like, was that a seizure? I don't know. They don't have any memory of having the seizure, and they just move on. Then we get to partial seizures. So these are ones that only deal with very specific place in the heads. You can have simple partial seizures. With these, it's normally like a type of sensory change or motor change. So it could be like, oh, it's got a really like numb spot going through my arm. And that's because that sensory portion of the brain was just kind of firing and having a seizure. Or you can have muscle twitching if it's working in the motor portion. Then you have complex partial seizures. And these kind of look like absent seizures, except they are going through a motion. So they're doing something, but it's purposeless. So it's not like a goal-oriented motion. So stuff could be like lip smacking, right? I actually had a friend growing up who had complex partial seizures, and he dipped a lot. And so, like, when he would go through one of the seizures, he could tell pretty common when one was about to turn on. He'd be like, okay, I'm about to have a seizure. And, like, he'd sit there and just, like, act like he's dipping when he doesn't have a dip in and spitting, like, in his hand like he had a cup. And then he'd just do that, like, over and over and then come out of it and, like, have no idea what happened. And it also affected his memory, like, overall. All right, so what do you use to treat these? There's a bunch of effective drugs, as you can see. A lot of this first groups of drugs are used for your generalized tonic-clonics, so for your grand mals and your partial seizures. And then we'll go through some that are just for partial seizures, and some that are for absent seizures, and some that are for status epilepticus, which we'll talk about. So Anticonvulsants, usually given intramuscular or intravenous. Anti-epileptics, usually given orally. Your anti-epileptics are just going to decrease brain excitability. Like, so what the seizure is just rapid firing, right? And so what you're going to do is stop it from rapid firing. Barbiturates are a type of anti-epileptic, anticonvulsive. It binds to the chloride channels. It enhances GABA, decreases glutamate. We've gone over barbiturates 3-4 times now. Phenobarbital is probably the go-to for barbiturates for the anticonvulsants and anti-epileptics ability of it. Problem with barbiturates is lots of sedation, lots of hypnosis. You also build tolerance to the sedation pretty quickly, so for maybe that first week, 2 weeks, like, it's gonna knock you on your butt, but after a while you will get used to the sedative effects. You'll build up a tolerance to that. And so that's why they can still use it as an anticonvulsant, anti-epileptic. Still not the go-to. Like, there are more preferred drugs than this. They're a lot safer in adults. But for children, like, phenobarbital works really good because it has a really wide therapeutic range. The next class is the hydantoins with phenytoin, dilantin. This one is a very potent anti-epileptic used for lots of different types of epilepsy, little to no sedation, right? So that makes it a little bit better than your barbiturates. It has complex activity on the neuron ion channels, so sodium, potassium, calcium. It's going to influence all these. Probably the major form of action is it prolongs the sodium channel inactivation. So if you remember from physiology how your voltage-gated sodium channels open up with the depolarization, and then they become deactivated, and then they close. This increases that deactivation time, right? Which is going to decrease the overall firing. We also see that it releases more GABA, which is inhibitory, and decreases glutamate, which is excitatory. And overall effect is it decreases the excitability of the brain. Side effects: dizziness, ataxia, postural imbalance, so you're not so steady on your feet. You can get some skin rashes. You get hirsutism, which is growing hair. This is an extreme picture, but really you see a lot of it on females growing hair on their face. And birth defects: if you are pregnant, do not take your hydantoins. These side effects are pretty common throughout your anti-epileptics. So the next group that is used for partials and grand mals is carbamazepine, Tegretol. Structurally, it looks like a TCA, so it looks like a tricyclic amine, but it acts like a phenytoin, right? It acts by inactivating those sodium channels, or increasing that inactivation in sodium channels. It's indicated for a lot of different types of seizures, also indicated for mania and bipolar disorders, and even has analgesic properties, so it can be used to treat trigeminal neuroglia, so pain coming from the trigeminal nerve. Trigeminal nerve goes to 3 places on the face: the maxilla, mandible, and yeah. Okay, so lots of face pain with that one. Side effects: nausea, vomiting, diplopia, or this is double vision, drowsiness, dizziness. It can have some more serious issues like jaundice, Bone marrow depression. This can lead to aplastic anemia. Also, don't take it when you're pregnant because it has a higher chance of your child getting spina bifida and having developmental delays. Valproic acid is the next one. Pretty cool because this one treats all types of epilepsy, so across the board. Similar to the two above it, by decreasing sodium influx, also blocks the NMDA receptors for glutamate, which are those excitatory receptors, increases GABA with little sedation. So it works really well. And here you can see this would be somebody's brain waves if they had seizures, and you see how it's just like rapid, just bam, 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 bam. And then your phenytoin, just bam, bam. Nothing, right? It brings it down really quick. Carbazepine, again, this one goes on for a little bit and then flattens out, and then sodium valproate or valproic acid kind of overall decreases and then comes down. Side effects, again, nausea, vomiting, tremors. This one you have to watch out for liver toxicity, especially in younger patients. And again, birth defects like spina bifida. Here's some other ones, even more. So, primidone, chemically related to your barbiturates, acts like your barbiturates because it gets metabolized into phenobarbital, right? So this is just, you take this one, and then it switches to phenobarbital and acts like it. Keppra, don't really fully understand what it does. Probably affects GABA, probably affects glutamate. Not 100% sure what's going on. It is good for adjunctive treatment for your partial seizures. It can give you sleepiness, dizziness, nervousness. Topamax or topiramate, again, not 100% sure what it does, but probably interferes with sodium, increases GABA. It can be used for your tonic-clonic seizures or your partial seizures, sleepiness, dizziness, mental confusion. Topamax is also indicated for migraine relief. Zonegran interferes with sodium and calcium channels. Again, your tonic-clonic and your partial seizures. Sleepiness, rashes, occasional renal stones, not real stones, renal stones. And then this group is just for your partial seizures. Gabapentin, pregabalin, Lyrica. They are similar in structure to GABA, right? But they don't behave like GABA. So you don't see them being a GABA agonist. They're not binding the GABA receptors on the chloride channels. Instead, they're blocking calcium channels, which decreases your glutamate. Lyrica has also been indicated for nerve pain like fibromyalgia. The side effects are typical, like you see above: dizziness, nausea, vomiting, that kind of stuff, headache. Vipat, this is an add-on therapy, so you need to have something else rolling, and then you can throw this one on if the first one's not doing the full job. It is only indicated for people 17 years or older. It enhances the slow activation of your voltage-gated sodium channel, so as it is inactivated, it's inactivated longer, right? Gabatril is a GABA reuptake inhibitor. Again, typical side effects plus mental confusion. All right, and then for your absence seizures, so these are the one where the person just stares off in space or blinks really fast and then comes out of it and has no idea they had a seizure. Succinimides, they decrease your T-type calcium currents. This is something that you see in the thalamus, and so bringing that down is going to bring down the entire reactivity of the brain. Side effects: nausea, vomiting, diarrhea, drowsiness. You may see a decrease in your white blood cells and platelets, and so increased bleed times, more infections, that kind of stuff. Tridon is pretty similar to your succinimides, except much, much, much more toxic. So the therapeutic range is really small with this one. And it also causes snow blindness. So it looks like you're looking at everything through snow. I don't know if you've ever like almost passed out before and you see all those white dots splashing in front of your face. This can cause that. Plus liver and kidney damage. Really, it's not prescribed a lot because it does have pretty serious side effects, low therapeutic range, high toxicity. But occasionally, if nothing else is working, you gotta try something, right? And then we get to our benzodiazepines. Again, we've covered benzos a lot for a lot of different stuff. The anticonvulsant properties of Valium, Klonopin, Ativan, side effects is sedation with them. Plus, we've talked about the side effects for these before. Ativan is also the go-to for status epilepticus. So status epilepticus is when someone has a seizure and it doesn't let up. And so it can cause stuff like heart attacks and permanently change the wiring in the brain, and not great, right? All right, so we're going to stop with that, and we're going to pick up with Parkinson's drugs in the next one.